Hi, everyone. I'm Shannon Stehouwer with Eli Lilly and Company, and I'm happy to present the 2021 Alliance for Aging Research Distinguished Public Service Award, which is given every year to a Republican member of Congress who is leading the way on policies encouraging medical research, innovation, and care to benefit Americans as they grow older. This year's honors Congressman Brett Guthrie, who is representing Kentucky's 2nd Congressional District since 2008. Representative Guthrie serves on the House Energy and Commerce Committee and is the top Republican member on the House Energy and Commerce Health Subcommittee. The Alliance supports many of the healthcare issues that Congressman Guthrie has championed, including his work to promote COVID-19 vaccines and debunking dangerous anti-vaccine information. Representative Guthrie has also provided leadership to improve Alzheimer's detection and care with the passage of the Bold Infrastructure for Alzheimer's Act and introduction of the Improving Hope for Alzheimer's Act. We are so grateful for Congressman Guthrie for his continuing commitment to place an out-of-pocket cap on Medicare Part D costs, and for his thought leadership on creating a mechanism to smooth these costs evenly through the course of the year so that patients can access and remain on the treatments that they are today. Medicare is the only major insurer in the United States that lacks an out-of-pocket maximum, and the impact on these proposals would be monumental for older Americans. Congressman Guthrie has also guided bipartisan efforts to improve access to evidence-based treatments of opioid use disorder and supported allowing pharmacists to deliver services such as blood pressure screenings, diabetes management, and immunizations services to medically underserved areas. These practical, real-world health policies demonstrate why Congressman Guthrie was appointed to co-lead the Healthy Future Task Force to form a solutions-based healthcare agenda. We are, of course, also thankful to Congressman Guthrie for his military service. After graduating from the U.S. Military Academy at West Point, he went on to serve as a field artillery officer in the 101st Airborne Division, air assault at Fort Campbell. But his most important accomplishment in life is no doubt being married to the former Beth Clemens, father to Caroline, Robbie, and Elizabeth, and grandfather to his first granddaughter, Rowan, who was born last May. Congressman Guthrie, it's wonderful to be with you today and to present the Distinguished Public Service Award to you. Congratulations, sir.
Thank you very much. And hello to everybody with the Alliance for Aging Research. I'm glad that you're all coming together to celebrate the great accomplishments you do in doing research and promoting research for older Americans and really for all Americans, because we're all going to become older Americans someday, and we're dealing with parents. Some of us are dealing with parents with their older Americans, so it really benefits us all. And thanks to CEO Susan Peshin and to your board and all the staff and all the people that are here together. And thanks, Shannon. Thank you for introducing me, and thank you for this award. And I look forward to our discussion.
Of course. And I'd like to ask you a few questions regarding the work that you're being recognized for today. Given your leadership on promoting policies that encourage medical innovations into conditions such as Alzheimer's disease and improving care for aging Americans, what do you think are some of the most pressing issues facing aging Americans today?
Well, thank you so much for that. What's really excited me about my service and being on the committee is innovation in healthcare. It's absolutely phenomenal, and particularly in aging services and Alzheimer's. When I was a kid, my grandmother's brother had Alzheimer's. So that's always kind of been in the back of my mind too. So the great thing about Congress is we're really are the American people. I mean, a lot of people want to say Congress is this, that, or the other, and we have our moments being this, that, or the other, but we're really just made up of the American people. And we all have these experiences. And so that experience, my wife's grandfather had Alzheimer's. And so seeing a family have to deal with that, trying to save the farm while dealing with someone of that level, it got me into this. So the BOLD Act, which was trying to focus on making sure we had healthcare infrastructure for Alzheimer's, the HOPE Act, that our healthcare providers are aware. A lot of times you don't know how to deal with people with dementia, that HHS educates our providers on how to deal with dementia. We're looking at other things moving forward. I met with President Biden. He's on the cancer research. I was in the Oval Office for one of the meetings on the ARPA-H, or the moonshot for cancer research. And as we move forward, the Brain Research Project, NIH, should be part of ARPA-H. And we'll see how that proposal goes forward. But I think that's important. We're trying to figure out how we make it work, and given some of the things going on in Washington now. But we want to make sure that we do, because I've seen it, solve this problem. When I'm 84 years old, I believe that's when all the baby boomers are going to be at the age of where a vast number of people are going to be on with Alzheimer's as we get older, if we don't have a change in trajectory. And we're going to spend over $1 trillion a year of government money, taxpayer money, just dealing with people with Alzheimer's if we don't change the trajectory. So that's been my mission. One, first and foremost, the patients, the families, but also the future of our children being able to afford a government.
That's great. Well, thank you so much for sharing your personal story and your commitment. It's really critical for aging Americans today. So thank you again. I also wanted to ask you about your work on making improvements to the Part D benefit. Could you tell us a little more about how creating an out-of-pocket cap and smoothing mechanism in the Part D program would benefit older Americans today?
Yeah, that's one of the things I wish we could get done. I remember meeting with President Trump then and talking about as we could do everything we wanted to do in prescription drug benefit, let's do Medicare Part D. We really couldn't get the House to, even though it's a bipartisan issue, both Democrats and Republicans support it. There seems to be a larger desire to do, instead of sometimes things get caught up, we can fix some things in health and pharmaceutical pricing. And they say, well, we're going to wait till we do something big. And it is big. Everybody over 65 years old is on Medicare. And so it's every American over 65. So this isn't a small thing. And the two things that the Medicare Part D, which is a great benefit, but the things that it really, well, the one thing that it doesn't really have that most plans have is a cap on out-of-pocket costs. And so we actually have paid for it. We have the ability to move this forward. And the other one is you hear from a lot of people, particularly with expensive medicines, that they immediately have to pay, several $1,000s in January because they have deductibles. I think there still should be deductibles. We should have programs for people who can't afford their medicine. Yeah. But people like my father, who's retired and has the ability, should have deductibles. They should have some skin in the game. But sometimes it's hard to come up with all the money at once. So one, we want out-of-pocket caps. Two is to smooth the deductible so you can pay it over a year. So you're not paying $2,000 in January. You may pay a couple $100s a month every month to smooth your deductible.
Absolutely. And thanks so much for championing that important issue. And, hopefully given the bipartisan support, we'll be able to move that along here shortly. And then lastly, I wanted to circle back on a more personal question. And you shared a little bit about your family's experience with Alzheimer's, but what have you learned from your own family about healthy aging? And are there any tips that you impart today to practice healthy aging yourself?
Since I'm becoming one of the aging, I'm trying to practice those ourselves. It's everything. You have to exercise, eat well. I mean, I don't eat perfect. I'm not going to claim that. I think we're here in Washington, D.C. and having late night votes. So I had more pieces of pizza than I needed. And I think you can do those things on occasion. I don't think you have to be a fuddy-duddy and not enjoy anything, but everything within reason. And so eat well. I'm trying to eat fresh vegetables. Fresh fruit is one of the things I try to do. I'm not saying I didn't have too much pizza on occasion. But then exercise, try to walk. We have a couple of rescue dogs. My wife is really involved in rescue dogs. So we have two, and then we have access to four because my daughter has two. So we're usually out walking them, moving them around. But I think really important to get with the theme that we're talking about is keeping your mind exercised. When you're older, read, find something you're interested in. I'm not a crossword puzzle person. That's just never been my thing. That's just what I suggest. It's to eat well, to exercise, and to exercise your mind as well as your body.
Absolutely. Completely agree. And those are small practical tips that we can all benefit from. But thank you so much for your time today, Congressman Guthrie, and congratulations on this much deserved award. We appreciate all that you do to champion these issues for aging Americans.
Well, I appreciate the award. It means a lot. And of course, we don't do these for awards, but it doesn't normally make the news when Washington's working. It makes the news when it's not. But I just want people in the alliance to know that there are members of Congress that are here trying to get things done. And I do think we're going to have a breakthrough. I don't have any insight because I don't know. I don't have any inside information. But I do believe just from everything that I see looking at NIH that I think there's going to be a breakthrough moving forward.
Absolutely. We could all benefit from that. So thanks again for your time.
Thank you.